Hello, my name is Chrissy Walks and welcome to my channel. So today I'll be going over the initial assessment appointments that I had to do for my bariatric program. I had to see the nurse, the surgeon, the dietitian, and the social worker on my team. And I even reached a little roadblock. It's very mild, but I'll be getting into that later on in the video. So the first person I seen was Dr. Wing, which is the surgeon on my team, and I had to go into the hospital on November 28th to do that assessment with him. So when I got there, I registered with the receptionist and sat down in the waiting room, and I met some nice ladies who were a part of the program as well, and we chatted up and we're talking about our history with weight gain and weight loss. And during that, Dr. Wing called me in, and when I went into the office, he weighed me first, and then we sat down to talk about my medical history. And all throughout that, I feel like he was just trying to gauge whether or not I'm ready for the surgery. And he even asked that himself, and I did say like I'm really ready for the surgery. I've done so much research, watched so many videos, read so many articles and everything. I just feel ultimately ready. I know there's a few more things that I need to do and get and learn, but I feel ready. And then he went over the two surgeries that he performs at Humber River. So it's the gastric bypass and the gastric sleeve. And just to explain those two, the gastric bypass, or root and Y, is a weight loss procedure that involves creating a small pouch and connecting it directly to the lower part of the intestine. This reduces the amount of food a person can eat and changes how their body absorbs calories, contributing to weight loss. And the gastric sleeve surgery is a weight loss procedure that involves removing a large portion of the stomach, leaving a smaller sleeve-shaped stomach. This restricts the amount of food a person can eat, leading to reduced calorie intake and weight loss. This procedure primarily focuses on limiting stomach capacity without rerouting the digestive system. So after he explained the two surgeries to me, he actually asked me which one I wanted to do. And I was kind of shocked because I thought like throughout like the medical histories and just knowing about me physically, he would have his recommendation and go with that one. But he said it's my body, my choice. So I just asked him for his recommendation. He did say that the golden standard surgery is the gastric bypass surgery. So I am leaning towards that one. Actually, I might just get that one. Before I left the office, I did ask him when he thinks that I'll actually be on the surgery table. And he says if all goes well with my appointments and everything, I will most likely be on the surgery table in 4 months. And like I said, I did hit a little hitch in the road, a little roadblock. So that might delay the time. I'm hoping it doesn't, but if it does, it's whatever, but I hope it doesn't. And after all of that, I went and did my first blood work, my pre-op blood work in the hospital, and I was on my way. All right, so moving forward now, I had the initial appointments with the social worker, the dietitian, and the nurse. And unlike the surgeon, these were all on the phone an hour after the other. Was on December 19th. And so for the social worker, we went over my medical history again, but she mainly focused on mental health and if I will have support after the surgery mostly, and personally or professionally if needed. She looked into whether or not I'll be able to afford the miscellaneous costs associated with the surgery as well, like with getting all the vitamins, getting the medications, changing your diet up and everything. She asked how long I wanted the surgery for, and honestly, it hasn't really been that long. I really wanted to go on Ozempic first, but switched into the surgery after some advice of my bariatric doctor. So it hasn't been that long, but I've been struggling with weight for a long time. So I feel like I've been struggling with it enough to want to get this surgery and to actually get it done. And that's kind of what I told her as well. And overall, she was really just trying to gauge again if I'm prepped for the surgery and if I did a lot of research, because she asked me the risk. So I had to tell her the risk of the surgery. I have to tell her the certain food stages that we have to be on after the fact. If I knew the things that I'm not allowed to have anymore, like alcohol, carbonated drinks, caffeine, things like that. She was just making sure that like I understand what I'm getting into. She even asked me which surgery I'll be doing, and then she asked me to explain the procedure. She was just really trying to gauge how well read I am in the topic, basically. which is understandable, very understandable. She then asked me my religious beliefs or practices because she wanted to know if anything goes wrong, if I would be willing to take a blood transfusion, because I think there's some religions that don't accept blood. But girl, give me that blood. I'm trying to live. Give me that blood, okay? So towards the end of the appointment, she actually said that she wanted to do a reassessment with me, and she said that it will be booked within 6 to 8 weeks, but it was actually booked right at the cuff of 5 weeks. It will be January 29th, and she wanted me to do 3 things. So she wanted me to stop eating in front of the TV so I can do more mindful eating. She wants me to have 3 meals per day, because at that time I was actually eating like 2 meals and snacking a lot, or 1 big meal and snacking a lot. So she wants me to fix my schedule and eat 3 times per day and snack in between if needed. And she wants me to get a letter of support from my family physician, and the letter of support basically states that I'm mentally prepared for the surgery and I'm mentally stable enough to get the surgery, and if anything were to happen, they would look into getting help for me. Basically, that's pretty much it. And yeah, that was all for my social worker. So next I actually spoke with the dietitian, and she was just really trying to get an understanding of my weight history, why I gained the weight, why my weight fluctuates, because I lose it and gain it and lose it and gain it real bad. She wanted to know the different diets I did, the different things that were in my life or that caused me to gain weight or to lose weight. Are they still in my life? Any things like that. The different exercises, I'm not too sure if I mentioned that, the exercises and diets and just everything in general. She was just really trying to gauge what I did and if I even tried to lose weight myself, which I definitely did. She asked me then if I knew the risk of the surgery and the different food stages post-op and what I'm not allowed to indulge in. You can no longer drink carbonated drinks, alcohol, no caffeine. You can't indulge in like drug use for a year post-op, I believe. And I think she said you're not supposed to drink carbonated drinks all throughout your life. Some people do, but honestly, all those things aren't a problem for me. I really don't drink or smoke or do all of that right now. So again, not an issue. She does want to do a reassessment with me, and that'll be on January 29th. And that's because she wanted to see that I'm eating more healthier, more protein over the carbs and the starches and everything. She just wants to make sure that I'm getting in the right amount of foods and the right categories of food, basically. And that's what she'll be checking on January 29th. And she even gave me some pages to read through on the booklet just to refresh my memory and just help me even before the surgery to do certain things that will help me out after the surgery. Now I'll even link the book, the resource book below, and all the pages that she told me to read down below as well, just so you can see all the things that she told me to go over, because honestly they're really informative. Alright, so lastly I spoke with the nurse, and she was just trying to make sure that I'm medically stable enough to do the surgery. She was asking me questions to further understand my medical history. She asked me what medications I'm on, and I'm not currently on anything. I was on birth control recently, but I got off of it because my bariatric doctor told me to stop taking it. So I got off of that probably like a month and a half or 2 months ago, and she went through my medical history in terms of like my current weight and my measurements. It was just my waist measurements I think she took, so I gave that to her. I currently use an app actually that has all my measurements on it. I don't know, I'll just post a picture of it here, all my measurements and my weight status as well. So she even asked me if I have like chronic issues, if I abuse alcohol or drugs, if I have respiratory issues, the whole 9 yards. She was just trying to figure out if there was like any hidden thing that wasn't on my medical records or history that wasn't disclosed or anything. She just wants to know before the surgery actually comes. But the only major thing that I really have, well, 3 major things. I have sleep apnea, a mild form of sleep apnea actually. I get migraines here and there, and my joints sometimes they really hurt, like my knees and my ankles. I have a lot of issues there, but honestly I feel like all those 3 things might go away after the weight loss, so I was hoping. After going through my medical history, she actually told me what medications I need to take, and I'm gonna show you it right here, all the medications I have to take before and after the surgery. She went into detail what exactly I need to do and why I need to do it, mostly because I am vitamin deficient. Yeah, like I even got this pill organizer from Amazon, and you can see it has all the pills in there that I need to take. So on the chart it did say that I need to take prenatal, and you might be questioning why I need to take prenatal. I was wondering it too, because I thought it was just going to be multivitamins, like, you know, your 1 a day, but she said that the prenatal is actually more potent in the vitamins and the minerals that I need, because I'm really deficient. But in order to remember to take all these things, because it's like 7 a.m. I have to take one, and then 8 a.m. and then 10 a.m. and then 5 p.m. So I have like an app on my phone to remind me when I need to take these pills actually. So it's been very helpful. I've been doing it now for 3 days straight. The next day I need to do is Wednesday, so I need to make sure to take from the Wednesday category. And yeah, so that's pretty much it. She doesn't need to do the reassessment with me like the other 2. So after the 3 calls, I rushed to call my family physician to get an appointment with him that week, because after everybody's going on holidays. So I actually got an appointment on the Friday of that same week, and I went in. I told him that I needed that letter of support, and I told him why. And he was kind of confused. He never got asked to do that before, but he told me that he wasn't going to be able to give it to me because he's not a psychiatrist. He told me that because I went to the Humber River and saw a psychiatrist in 2021, I would need to go to that same psychiatrist to get a reassessment with him. And yeah, so I couldn't just get that letter of support from him, unfortunately. I even called the social worker afterwards and told her like what was going on, and even herself, she was kind of confused on why my doctor couldn't just give it to me. But I guess it's all for the better, just to make sure that I'm all the way through mentally and physically, and just every inch of me, I'm just wholeheartedly ready for the surgery. So I kind of do mind, but don't mind at the same time. So yes, I need to go do that reassessment. I think it really depends on the psychiatrist if I need to do it or not, because if he says like, oh, she's all good, she doesn't need to do it, then I guess my doctor will just give me the letter. But we don't know. We'll see what happens in the future. So yeah, so that's the little roadblock I'm experiencing right now. It might put a little delay in my journey if I do need to get that reassessment, because I don't know how long that would take. And mind you, we're on holidays, or everybody's on holidays right now, so I don't think I'll be getting that appointment anytime soon. Maybe in the new year if anything, but we're gonna have to see. Well, thank you so much for watching today's video. If you are on a similar journey like myself, let me know in the comment section below where you are in your journey, if you're having any roadblocks or similar roadblocks as myself, or just if you have any questions for me. And remember to like the video, subscribe to my channel, and turn on your post notifications, because I'll be posting really soon. Bye.